At first, the back pain was manageable. It started as whispers from my spine, but then came the feeling that my brain was on fire. I couldn't sleep. I couldn't focus. The pain was starting to take control. I started canceling the heart surgeries I had been scheduled to perform. No one knew why. I kept my pain hidden. I just kept going. But one day, while holding a beating human heart, my gloved hand seized. My right hand, the one I trusted, stopped communicating with my brain. The scans showed what I feared: years of damage from the work I loved. Cervical spine degeneration, they said. Now the surgeon needed surgery. I cried alone in my car after every doctor appointment, not because of the pain, but because I knew what it meant. I wasn't a surgeon anymore. I felt eviscerated, hollow. It wasn't the unrelenting pain emanating from my spine that broke me. It was the unceremonious ending of the career I had loved and worked so hard for. I lost my surgical career in silence. A certain friend had taken his own life not long before. The thought crossed my mind that I didn't want him to be alone. This is an excerpt from an article written by this week's guest. Dr. Paul Fedak is a cardiac surgeon and translational scientist at the University of Calgary. Dr. Fedak wrote this article that was published in the Globe and Mail back in August of 2025. And to us, this was such a raw and honest and vulnerable piece that Dr. Fedak put out into the world. And it touched on the central core concept that we've been struggling with and thinking about and talking about on the podcast, which is, how do you go about chasing excellence in anything, whether that's surgery or anything else, without losing yourself in the process? We talk about a whole bunch of things in this conversation, including burnout, maybe about how we can change our approach to doing surgery and achieving excellence. And Dr. Fedak has some pretty provocative things to say on the subject. But I think most importantly, Dr. Fedak asks us to examine why we do the things that we do. Why do we chase excellence in the way that we do? And he asks us if maybe there's ways that we could do it differently. We invite you to listen to the whole conversation and check out Dr. Fedak's other fabulous articles, as well as his blog posts and other links that we're going to put in the show notes. We'd love to hear your thoughts. Send us an email at podcast.cjs@gmail.com.
Welcome to the Cold Steel Surgical Podcast with your hosts Amir Farouk and Chad Ball. Paul, you've talked a lot openly, both verbally and written wise, about your dad. Can you fill us in on your dad's story and then how he's impacted, obviously, not only your career, but your life in general? Thank you.
I will, as long as you promise not to share this with him. Just kidding. I'll be careful what I say. No, I have a great relationship with my dad. I have a huge, huge respect for my father. When I was a child, my mother left. So this was back in the, 70s. My dad single-handedly raised my sister and I. And he's a busy lawyer, and he took that on at a time when that was almost unheard of. So this is a man with enormous commitment. So I learned a lot about professionalism from him and commitment and dedication, and really I saw him give back to the community a lot. He would never turn anybody down, a client, even if they didn't have any money. He would help everybody in the community at his own expense, at the cost to his own life. In many ways, he put other people first, and I think that seeing that type of professionalism, that integrity, really had a huge influence on me, and probably is one of the reasons why I pursued medicine, because those are really the same ideals that we have in medicine. Those are important parts of being a physician.
People should really go and read the article that you wrote in the Globe and Mail, and where you talk and write so beautifully about your relationship with your father and what it was like growing up with him. And I think we'll return to this theme a few times during our talk. But you kind of talk a little bit about how your father would sneak you into the movies and you'd watch movies with him. But there was a sense also from your father that you had to hold things close to the chest, that you would kind of grit and bear through whatever life threw at you, no matter how difficult that was. I wonder if you could reflect a little
Mm,
bit about that and what that taught you and how that informed your view as a surgeon.
happy to. So I think, like many of us, especially the relationship between sons and fathers, um, there's a mystique, right? There's a mystery around fathers, right? They don't reveal their whole selves to us. And that is a bit scary in some ways. I think when you're a child, but also intriguing. And I think with fathers, there's always this feeling with the son that you want to prove something. You want the recognition, you want the respect from your father, beyond the father-son relationship for you as a man, right? And I think that really molds many of us. And I would suspect that many of the men in surgery have had probably similar fathers, somewhat emotionally detached, but super high expectations, and a feeling like you want to prove to them your worth. And I think that's part of my story, and it's probably part of many surgeon stories. And that same mystique, I think, extends to surgeons, right? Like we carry that same kind of mystique where we don't always reveal all of ourselves to our colleagues and to our team. And people talk about the surgeon mystique, right? People, maybe a few words, seem a little emotionally detached, stoic, but very brave, very courageous, very dedicated, very committed, very hardworking. Those are what like many fathers are like. So I was fascinated by that, and of course, I grew up in a time where they really imprinted on us this um, male sort of phenotype of heroism, right? So that's what I was referring to in those meetings. Like in my informative years, being snuck into these restricted Charles Bronson movies, the vigilante, all these action films, right? And there's the hero, right? And you kind of like, and you get imprinted on that and kind of think, well, that needs to be your story too. Like we all feel like we need to be brave and be heroes, and that stoicism is a strength in surgery in many ways, but it can also harm us at times. And these are some of the things that I'm speaking about now and trying to unpack that a little bit, that our strengths can become our weaknesses.
That's so interesting, Paul, and so eloquent and well spoken as you always are. I'm curious how you see that reality uh, changing over time, and in particular with this current generation of recent graduates. How do you think it's changed? How do you think it will change? How does that sort of, if you do see change, how does it impact how you interact with them and how you move forward in a I would argue relatively significant evolution over a relatively short period recently?
Mm. Yeah, it's a great question. And certainly we feel the divide between those of us who are, many of us in more senior leadership positions now are like Gen Xers, and we were sort of raised by a certain generation and certain expectations, like I was referring to. The new generation is different, and partly because I think we're different, as how we're raising our own kids, right? And they're much more open. They need a lot more emotional support. They want to talk about feelings. These are things that we didn't grow up doing, right? And we were very self-sufficient, and they require much more support. So the expectations of what they expect for training or for what their jobs are different than I think what we expect. And I think sometimes that clashes because we see it as a conflict with their commitment to the profession, which we feel so deeply, and we've sacrificed so much for the privilege of doing this job, and that sometimes we're at odds with the younger generation because they don't seem to carry the same values we have. That being said, I think there's something to learn from their perspective, which I've sort of been unpacking, more recently with my inability now to practice and going through the struggles that I went through, that some balance, right? Some sense of self beyond your professional role and your professional identity is absolutely critical. And I think the young people are wise in the sense that they want to retain that. They don't want to completely lose themselves in the job, whereas many of us looked at it as that's what you're supposed to do. And that's the commitment, right? That's professionalism. And sometimes we can lose our own humanity in that process. And we can lose a sense of ourselves, right? And I think that can be damaging when you're under extreme load. And I think this is partly why we see some of the burnout, moral injury, PTSD, mental stress, and even the depression and suicide that we're now dealing with in the practice of surgery, and we're losing colleagues. I think it's important that we unpack that a little bit of, if our surgical identity is so strong, and certainly that was my case when I lost my ability to operate, I completely unraveled because it's like had put so much of my identity into that. I didn't even realize it, I'll be honest with you, until afterwards. So we can learn something from the young people, and of course they can learn something from us, and it's all about balance. Everything, if there's like a key message behind anything I'm trying to say, right, it's balance. And we know that inherently, we talk about it, but at the same time it's a bit of a conflict and a tension, because we also realize that to be truly exceptional at our craft, there's no balance. You just gotta like be all in, right? You gotta be in for every case, and the more you do, the better you get, and we're rewarded for that, and that becomes our identity. So it's a tough go, right, of how do you balance your interest in being truly exceptional and reaching the highest levels of your craft without losing yourself.
There's this beautiful line from your Global Mail article where you say, heart surgery is intoxicating. The focus, the precision, the privilege of holding a life in your hands and giving it back. But the thing that intoxicates you can also become toxic. I gave my career everything, my time, my family, even my body. Is it possible to chase mastery? So my question to you really, like, and you're bringing this up, and one of the things that I was struck by in reading your work is there is this tension. And it's something that we've played a lot with on the podcast. Is it possible to actually achieve mastery at something without losing yourself in the process? I mean, you think about like the sort of the stereotypes around Kobe Bryant or any of the, legendary athletes or musicians of our time who really kind of gave everything that they had to be as good as they are. And there's, I think you did that. I think anyone who really wants to be a good surgeon has to do that. So how do you resolve that tension, and how does one find balance?
Yeah. I mean, it's such an important question. And it's something that I'm researching and unpacking and reflecting on and contemplating and speaking about and having these types of conversations. So I'm learning. So I want to make sure that the listeners understand I don't have all the answers, and not everything is a problem that needs to be solved. But let's talk about it a little bit more. So um I think that you can. So I do think it's possible. I think at the heart of it, though, is you have to understand what's driving your mastery. Is it truly 100% just that you want to save as many lives as possible? That's part of it. But part of it is also personal exceptionalism, like the need to be the best, the need to be better than the guy beside you, right? That part is a little more toxic. That part is a little more maladaptive. And I think if you were to tease out what is true mastery in the sake of your mission, and knowing really what your mission is key too, then I think you can find the right balance. And I think it's absolutely critical for us as surgeons, because we are really hard on each other. We are not always supportive of each other. And we need that. This is a really tough job under very difficult circumstances. We need to support each other. We need to elevate each other. And this is where the issue of mastery, I think, needs to be reframed. We think of mastery as very individual. Surgeons, right? We're like lone wolf. It's like us against the world, and we're going to do everything come hell or high water. We're going to do everything possible to achieve our goals, right? That's cool and it's effective, and we're very good at that, but it comes at a cost, right? And I think we have to be mindful of what that cost is, and we have to start thinking less about individual mastery and more about team mastery. So, right, which means that Maybe you do a part of the operation, not the whole operation. Maybe there's multiple surgeons in the rooms. Maybe success and mastery is how well does your division achieve collective outcomes rather than you individually. I'd say that's a cultural change. I don't think as surgeons we really think that way. And we don't always work in teams as much as we could. And the difference, and I talk about this a lot, is, between groups and teams. So, when a team is a team is a group that has a common goal, but different skill sets all kind of working together. Groups are people who have the same skill set, but have different goals. And what I find is totally fascinating is as surgeons, if there's a complication in the operating room, you mobilize all the surgeons around, everyone comes in, the purpose, you're saving that person's life. And everyone has a little bit of a different skill set. They bring to the table vascular, neuro, etc. General surgeon, maybe we're working together in a cardiac case. You are a team in that moment because you're using your diverse skill sets for a common goal to save that person's life. But interestingly, as soon as we leave the operating, we're good at that in that moment, right? Nobody squabbles, nobody fights, I don't like that guy. It's about the patient. You walk out of the operating room and all of a sudden we're a group. Yes, we're all surgeons, but we have different personal missions and goals and agendas and that sort of thing. But imagine if we looked at mastery as truly that team. Like, how do we reflect on the whole group of surgeons working together and what can we achieve together? I think that's a leap, and it's something that leadership needs to think about.
Yeah, it's such a fascinating and provocative idea to think of ourselves as a team because there's that whole line about um, the operating room being the loneliest place in the world, right? When you have a
Yeah.
complication, right?
Yeah.
And suddenly, it is a team, and then all of a sudden, when there's something going wrong, it feels like it's just you at times, right? Where everyone's looking to you to figure out what to do here, because suddenly you're the captain of the ship, and really this ship is going down. But that what you're talking about is a very different sort of radical change in our mindset and I still find it hard to wrap my brain around, particularly in training, right? Um, I- how do you communicate a message around mastery? I remember Neil Dada, so you probably know, right? Is one of our colorectal surgeons in Calgary. When he was a program director when I started in Calgary, and he sat all the residents down who were starting in my year, and he said, "Listen, you have 5 years to become a surgeon, and your life is gonna be so incredibly difficult if you don't take every single opportunity
Hmm.
to become a good surgeon, and if you don't if you you got to stick around for every possible case that you can." Now he never, just to be clear for anyone listening, he's not telling, didn't tell us stay post call, blah blah blah, all that stuff. But what his point was that you just have to grab every opportunity that you can, and there's just no um, substitute for volume and repetition. So I'm curious how you see that tension resolved, particularly when it comes to training, when really there is a very short period of time to try to
Hmm.
achieve technical excellence.
Yeah, and it's a great point, and I don't want to confuse for the listeners. I am not saying that accountability is not important, and I'm not saying that merit and excellence are not, but completely not what I'm saying. Um, but control and accountability need to be aligned. So if we're looking at kind of team mastery, there still has to be accountability for individuals and the role that they play. And they also need to be given control of those parts, or the whole thing kind of falls apart. So I do agree that you have to be absolutely committed to this, right? Like, and the trainees, like, there's no question you have to show up and you've got to be present and you've got to get as much experience as you can. That being said, why we say that is because our training system looks like this. It's like, we're going to train you for 5 years and then you are independent. And then you have to be a hand surgeon, right? So a hand surgeon meaning you have to be able to operate on anything you get your hands on and be fully competent and completely independent. Well, that's a lot of accountability for an early stage surgeon. I mean, there are other models, right? And if we really think about it, in many cases, a junior staff person, the senior people are kind of keeping an eye and they're helping out and whatever. So we do already have a team mastery kind of thing baked in. We just don't really formalize it in any way. And I think that's unfortunate because there are situations where people get hired and yeah, they did the best they could. They were fully committed for the 5 years. They're so-called independent, fully licensed. But let's face it. I mean, you can't handle absolutely. We're always learning. I learned from every case I ever did. So it never stops. The learning curve never stops, right? And the whole thing of competence or not competent, in my opinion, is pretty fuzzy. But of course, we need to have those checks and balances to run the system the way we run it. But I think from a training perspective, imagine if you did have more of a team mastery, team excellence, team accountability feel. And some groups do have that. They just naturally gravitate towards that. Some don't. But imagine if you had that, I think you wouldn't feel that absolute same pressure of like, I have to know everything in this 5 years because I'm going to be fully accountable and there's going to be no help for me. And it's going to be a real rough career if I can't do absolutely everything at the very best right out of the gates, which is not, I don't think that's possible. I mean, I don't think anybody if that were true, then what would the value of experience be? And why are some surgeons more masterful later in their career than in early stages? So it just isn't true, right? So again, it's just a way of thinking about it. But bottom line, I absolutely someone has to be accountable. And what you alluded to, I think is super important and is a real stressor for surgeons is like the current, mantra or the current philosophy is like we're all a team and everybody's equal and no one's better or higher than the other person. But I think for surgeons, we're like, yeah, but when the patient dies in the operating room, no one comes with me when I go tell the family. Nobody, right? I'm alone, right? And M&M routes, there's nobody there like kind of saying, oh yeah, but I, coerced this or the clinical momentum drove. It's like, no, you did the case, you did this, this is what happened. And I think that is something we've got to, not that we should give away our accountability. I think it's critical that if you're going to take a knife to somebody, it's a huge responsibility. You got to be responsible and accountable, but that sort of when everybody disappears thing, I've never really loved that myself, and it's tough on surgeons. And then, but again, like colleagues should be supporting their other colleagues in those situations, and we don't always. We're competitive.
Yeah, like in one sense, what you're saying is like we just need to acknowledge in many ways what we already do. Like
Hmm.
drop the bravado and the words that we say and actually say what we all do. Like the reality is many folks go out of their residency and do a fellowship for many reasons. One, because of the
Hmm.
complexity of the care that we now delivered, and one because they had extra experience and specializing in something that I think absolutely makes you a better surgeon. And you're absolutely right. We do look out for each other. If you're working with a good group,
Hmm.
the senior surgeons do come already and give you a hand. But we don't. I think, and correct me if I'm wrong, but I think much of what you're trying to do with your writing and the work that you're doing now is actually just having people acknowledge that reality that yes, we have to try to be the best that we can be, but we're not operating alone in a silo, and nor should we be. And we should be there for each other.
Yeah, great point. And I mean, here's the thing, right? Is there are a lot of things that happen in surgery. There's a lot of hidden curriculum. There's a lot of silence. There's a lot of unspoken words. Um, and that cultural piece kind of even goes back to what we first talked about with like the fathers that raised us and the culture at that time. And I think it's changing where this shame and blame culture and this culture of silence where you don't show vulnerability, you don't express your pain. This is how we were raised. And that's how the workplace is for us. And you will be shamed if you show weakness, or you will not be trusted, or you will lose referrals or patients or the trust of your team or your patient. So there's like real consequences to this. But that being said, I think now there's a shift and it is time to talk about the things we don't talk about. And if unless we address them and talk about them, people remain harmed and under stress and nothing changes. So part of what I'm trying to do is just have the difficult conversations, which are the conversations that nobody wants to have. I'm trying to make those a little bit more normal, right? To say like, hey, look, I'll tell you my story And it's nothing to be shameful about. It's life, and we're all human, right? And these are things, you're going to have ebbs and tides and flows all through your career, and you're going to run into trouble at times. And what I'm most concerned about is that with the culture of silence and stoicism, is that surgeons will not ask for help when they need it. And that could be as simple as you're struggling in a case, and if you just ask the guy next door, the outcome would be better, but you're afraid to because it might look bad for you. Like, that's a small, not even that small, but that's one. But I'm also referring to the situation where you're under stress, you're depressed, you're burned out, you're having mental health issues, and you refuse to acknowledge it and ask for help because there's so much help out there and it's so effective. And we're losing surgeons because, in my opinion, they're scared to ask for help. They're scared to acknowledge it because they've been socialized and trained not to do that, because it's weakness, but it's not. It's strength. And I just think that's something that, through talking and through, further conversation, I think we can move the needle on that and protect these exceptional people, right? I mean, it's so tragic when I see these super talented people, often mid-career, top of their game, and they take their own lives, and it's so sad, right? And it's often men, and I think it relates back to identity and all these other things that we've been talking about through the podcast. And here's uh, I'm taking up a lot of the time. I know you have more questions, but I want to make this point too. This is where podcasts and what you guys are doing is so important, because this is conversational leadership, what you guys are doing, right? It's a type of leadership. And this is very different from like the TED Talk kind of thing, which, Chad and I are experienced in that, and that has its place, but that's very mono message. There's no perspectives. It's like, you've got one message to give, and you give it. And that can be important. But what you guys are doing is different. The podcast is a beautiful way of taking us outside of our normal environment and allowing us to explore these things. So I think, like, the questions you're asking, the conversation we're having, I wish we would have that in our surgical meetings in divisions and departments, which hopefully will happen at some point. I haven't seen that happen, but you guys are leading that, right? By doing these podcasts. And I think it's absolutely critical. And if anything's going to change culture, it's probably going to be these real, open, vulnerable, authentic conversations that we're all having, and coming to the table like this with the presence to put our egos and our fears aside so that we can be honest with each other.
Well, I think you're certainly showing us the way in terms of how to be vulnerable. Like, the whole Brene Brown kind of mantra and the idea of leadership and as being vulnerable. I think you've done that with the way that you've written and spoken about your career. I want to pick up on one thing that you said about this idea of identity, and you mentioned this before when, for our listeners, you had some issues with your hand that actually prevented you from being able to do surgery because of many years of operating and getting cervical stenosis in your spine. And you write about this as well too, about losing a sense of self. And I think that's when I read that, that really resonated with me because I've always said that surgeons don't retire well, right?
Oh yeah, yeah.
Our whole identities are wrapped up in this pursuit of mastery of this craft, right? So can you talk a little bit about what it was like to sort of lose your identity and how you've come to terms with finding a new one?
Yeah, this is the toughest question of all. Um, I didn't expect that, yes, I am a clinical heart surgeon, or was, but I also did research and leadership and innovation and consulting work and all this different stuff. So if anybody shouldn't be so tied to the identity, it shouldn't be me. It should be, the person who just cuts every day and is like the high volume, like, always operating guy. Or girl. Um, but I was shocked by how much it affected me. And I truly, when I say unraveled, like, I became very depressed and I was completely lost because I was so passionate about doing this thing, and it just meant so much to me that when I could no longer do it, I felt like, yeah, there's other things I can do, but they're not that thing. That thing is a special thing. And that thing makes me exceptional. And it brings so much, it's such a gift for me, right? That I didn't really appreciate. We, of course, we do it for others, and we do it for our families. We do it for a whole bunch of reasons, but we do it also for ourselves, and we get so much out of it. And we need to kind of appreciate that. I couldn't appreciate it until I could no longer do it. So for all of you that are in practice and you're like hating your day, and you're, it's because it is a hard job, let's face it, and you've been on call and you gotta operate, and all the stresses and expectations and everything else. I mean, just remember that if you suddenly couldn't do it, it would devastate you. It would absolutely devastate you, because it really is special, and it really is a privilege to have the opportunity to do it. So I'm very fortunate that I had the career that I had. I wish it had lasted longer, but I'm so lucky to have had that chance. So few people get that chance. So I think that's really, you know, I'm trying to spin it into a positive in some ways, because I don't want to depress people, but the identity piece is important, and it's important to figure that out, and to make sure there is somebody else behind there. Because like you said, just like we apprentice ourselves to become surgeons, we have to apprentice ourselves to not be surgeons, because that time will always come, hopefully later than sooner, and hopefully before someone puts a hand on your shoulder and tells you to hang it up, and hopefully you'll have the insight to know when to step away. But you have to, because you can't do it forever. So we all go through this, and we often see people heading towards retirement really struggling, and maybe staying a little longer than they should, right? And the old saying, you can't retire a day too early, but you can retire a day too late. So because we're not ready, we haven't unpacked it. We're so tied to the identity, and it's hard not to, because we have to commit so much of ourselves and sacrifice so much for the opportunity to do it.
Paul, that's, you know, not only insightful, but really, really important as you're telling us that. I want to take a bit of a tangent
Sure.
on that topic though, and get your feelings, which, you and I chatted in clinic randomly one day, and you were sort of talking about this. And after I left that day, I thought a lot about you and about what you had said to me. And one of the sort of, I don't know, analogies maybe, that right or wrong, and I'm curious what your thought is, but when you consider the professional athlete, and obviously this will date this podcast, but today Canada's playing Finland, and you think about how young those guys in general, as a rule of thumb, are when their career is effectively over and they have to move on to something different. I think we all know that, and it's interesting. I grew up in Edmonton with a younger brother, a couple of years younger, and we both played hockey, as so many of us all do in this country. And there was 21 guys in our age group that played in the NHL. And I can honestly tell you, despite, I'm not saying good or bad guys or anything like that, but I would suggest to you that, my brother and I would say probably 19 of 21 are not overly happy,
Hmm. Hmm.
well-adjusted guys in their early to mid 50s. And so, to your point about the difficulty of retiring and difficulty of knowing when and all that sort of stuff, it's a little different, right? Because they're sort of just, they're cut one day and that's the end of it. But I think the psychological side of it is
Hmm.
actually very similar. And so I'm curious, on your voyage, if you've been able to identify any concrete recommendations is too strong a word, but sort of insights into getting ready for that, or being ready for that, or being ready for the unexpected, again, as you point out, at a relatively young age, because not only of the physical demands of some of
Hmm.
our jobs with call and with just the physicality of doing big cases, but even the mental side of it, of course. Some people hold on longer, some people don't, as you point out, but there's sort of all those elements. And I wonder what your advice is or your
Yeah,
comments are.
this is such an important conversation. After I came out with my own story, um, which I had no idea how it would be received, right? I just felt I need to speak my truth, right? And I need people to hear this for whatever reason. Um, and I wrote it in a way that I felt like I was at a point where I understood the story I had been telling myself for my entire life. And the thing that I went through, which was so difficult, actually woke me up. And what I mean by being woke, maybe not in the traditional sense, but really being present and understanding the reality you're in without judgment, without lying to yourself about this or that. And some of you may understand what I'm talking about, some of you may not. And I think that's the difference between being awake and not being awake in that sense of your identity. And I think it's something that we all need to kind of unpack and be real with ourselves at times, because if you do that, then you can understand that this professional identity isn't the real you, right? And I talk about it a little bit in the article as well. It's this difference between doing and being. We're doers. Like surgeons, that's what we're known for, right? Like we're people of action. Like we intervene. That, like we're all about errors of commission, not omission. Like we talk about these things. Like we know that. Everyone sees us that way. And that is, I think it's very true that we're doers. So we're so in the doing that we kind of lose our presence and our sense of being sometimes. And if there's something that I've learned, it's that you should explore that being aspect. And what that means is that, like, who are you when you're doing? When you're being excellent and when you're achieving and when you're doing mastery, who are you being in that moment? Right. And we think about excellence as the thing that we do and the outcomes that we achieve. But I think we should also be thinking about excellence as um, being present in that moment and being aware of the people around you and elevating them and supporting them, and also the self-care, right? Having self-compassion. Like we're hard on ourselves. Imagine if you were as compassionate to yourself as you were the patients that you treat. If you gave the same amount of attention, the same thought, the same, like I know surgeons, we're all confident, but we think about these things and we ruminate over our patients and worry if they're okay and if we did the right thing. And what if you did that for yourself? I bet you never have. Um, so that's what compassion, self-compassion has to look like, that you treat yourself with that same level. And I think if we did that and we focused a little bit more on who we are, rather than what we're doing, we might be able to prevent some of not all of it, but it might make some of this a little bit easier. And it might make transitions into retirement easier. And certainly these things that we're talking about here are not completely unique to surgeons, right? You brought it up. I mean, athletes, it's real for so many people. And I was shocked by that. After I wrote my story and it was published in the Globe and Mail, I had hundreds of people reach out to me, letters, phone calls, letters, like them telling me their story. And I could not believe how common these stories are. It's almost like it happens to everyone in some way at some point in their life or their career, but many people don't talk about it. And what's beautiful is that when they do, you realize they're not alone, right? And there's no harm in speaking about these things. It's part of life. And when you meet these other people, they're all, because they understand and they've been through it, they're very supportive. And that supportive network creates a kind of healing, which is really nice. And I think this is what something we could do in surgery is create those supportive networks where people can share their stories. And I think that may go a long way to helping solve the burnout crisis that we have.
We could talk to you for a very, very long time about these questions because I think there's just so much to unpack here. I am curious, what do you think? You talked about maybe changing some of the ways in the way that we think, almost more of a team-based approach, perhaps. Um, those might be some starting points for making our cultures and our training programs healthier. But if you had a few things that you think would be maybe concrete's not the right word, but a few thoughts that you might have about how we can make our training programs in particular and our culture healthier, what would those things be?
So things that we've already talked about, I think, are relevant, like shared accountability. So it's not just all on you, right? That there's more shared accountability for outcomes. and working more in a team-based manner. The other would be the support network. So, for example, there's a second victim phenomenon when, you have a bad outcome. If you actually get support and talk about it, and I don't mean you need to lie on a couch and, whatever, light candles, like we're surgeons. It just means like a colleague reaching out to you without shame or blame that you trust and being like, hey man, are you okay? Like, how do you feel about that? Like, that was a really hard thing to go through. Like, how many surgeons could say that's happened to them? They may have fortunately had a senior colleague who said, "Oh yeah, you should never have done that," right? And here's why. But not like, how do you feel about it? What's going through your mind right now? How can I support you? Hey, do you want to take tomorrow off? Um, and I'll cover you. How often does that happen? I mean, like, probably almost never. But if it did, I think it would go a huge long way to taking those negative experiences and actually learning and being better and having better emotional regulation around those kinds of issues. So that kind of stuff could happen. Like tomorrow, we could do that. A national peer network. I'm in discussions with somebody who trained me in Toronto about setting up something like that, where you may not be comfortable talking through some of these things with the guy in the OR next door, and they were in the office next door, but you might with a similar general surgeon, orthopedic surgeon in another city. So there could be these professional peer networks that we can develop, but ultimately, the system can only do so much, right? I think what I'm really getting at with a lot of this is trying to go real deep on a lot of these issues. And it really comes down to like self regulation, self management, self compassion. This is where doing the work, as it's called, is really important. And we're so busy and we're so successful and we're at the top of our game. We feel like we don't need to do that, right? Because, like, well, like, look, I'm the successful surgeon and I've got good outcomes and people respect me and I'm a pillar of society and got a great family and life. So I don't need to do any of that. Well, yeah, but when something fundamentally goes wrong, like what happened with me and other people, you may not be as resilient as you think in certain moments. And that same degree of stoicism, this is what I referred to earlier, is that our strengths can become our weaknesses. So there are certain situations where that stoicism, yeah, it's good to get you through a case. You can't start crying and getting emotional, needing like a emotional support dog in the operating room or taking breaks to collect yourself. No, there's no time for that. But a bigger picture is that there are certain situations where, stoicism is not helpful. And when you're going through this chronic stress or mental stress, etc., your stoicism of not asking for help or receiving help can be deadly. And we've seen the consequences of that. So I want to make sure that people do the work and work on themselves, that, get a coach. Like, coaches are phenomenal for this sort of thing. They really are. I've worked with coaches because I went into leadership. And honestly, I learned so much about myself by unpacking with the coach. Like, here's the scenario I was in. Here's what I felt. Here's how I subjectively interpret it. We don't talk about our feelings a lot, and I don't mean it in a fuzzy kind of kumbaya sort of way, but more in a truly optimization way of performance. Of like, you need to understand what you're feeling or what you're thinking or the story you're telling yourself, so that you can be real and present in that moment and face reality head on without judgment and execute on what you need to do. And we're great at that in the operating room. I don't know that we're so great outside the operating room.
I hope folks are really listening to what you have to say, because I think you're saying some really, really important and profound things that um, are perhaps actually hard to listen to at
Mm,
times for folks. Um, it's much easier to just keep on going, right? And then suddenly wake up one day and have to deal with it. But there are other ways of being, as you say, right?
mhm.
There's other ways of tackling these things. I before we close, I do have to ask you a little bit about your writing.
Sure.
I'm struck by the way that you write, and I get the sense that you're someone who enjoys writing and has thought deeply about these things, and you get the sense of, like, like John Milton, who wrote Paradise Lost. He was blind, and he would say to the person who would come and scribe for him that, like, milk me, right? Like, there's this pouring out, and you get that sense in a way, I think, at least when I read your work, of this outpouring of what you've been feeling and what you've been thinking about. I'm curious, just if you could talk for a second about what you think it means to be a writer as a surgeon, and what that writing process is like for you.
Yeah, great question. Um, yeah, I didn't really, it's not like I intended on ever becoming I don't think of myself as a writer. I'm somebody that just has something to say, right? And writing is a way that I can express it, just the same as we can have these conversations and I can express it that way, or give a presentation, or some people, do art and that's the way they express how they're feeling deeply about something. So, so for me, that's where it comes from. And I'm very sensitive to the precision of words. So the way I write is with a lot of economy and efficiency, just the same way we do surgery. I mean, it's surgical writing, right? It's very intentional. It's strategic. It's short. It's restrained. It's punchy, and it gets right to the heart of the matter, right? It opens the chest and gets right into the heart, like in 30 seconds, like an emergency case. So that's kind of the way I approach it. So I think surgeons have a certain style about them, and they embody certain values and principles, and a perception and a way of thinking about things. And I'm trying to leverage that, I guess, in a way, uh, in the writing, and in some ways, maybe it's a unique style. It's To me, it's honest, it's authentic. I'm just trying to be as real as I can. Hemingway said, just write the truest sentence you can. That's good writing. So that's what I'm trying to do, and I'm kind of shocked by how much it's resonating with people, and that people will actually read it and get something out of it. Um, and part of it too is like I'm really trying to embody the experience that I had. Like my piece called The Mountain. I don't know if you saw it or not, but it's about a surgical case, and I'm trying to put you in the situation as if you were me, so that you can feel. And I think this could humanize doctors. And I'm noticing that when the public reads this stuff, they say, "Oh, I never thought about the doctor's perspective on that, or what they might be going through, or how hard that would be for them." And going back to some of the stuff we talked about, I think if we were able to communicate effectively how we were feeling or thinking, or our perspectives on certain situations that we're put in, people might have more compassion for ourselves, and we might have more compassion for each other if we were to understand those perspectives. But we don't share our thoughts and feelings very often, so we don't know. And if we don't know, we make stuff up in our own minds, and usually it's negative, like that guy's trying to do this to me, and like paranoia stuff that surgeons tend to do.
Yeah, I don't want to get too much on a tangent on writing, but it is interesting that we come from a long line of like, there's a long history of surgeon writers that people love to read, like Atul Gawande, and When Breath Becomes Air, Paul Kalanithi, like some really really fantastic surgeon writers. But yet we don't, like, I remember when I was interviewing for residency, I had an interest in humanities and surgery, and that was on my CV. Humanities and medicine, humanities and surgery, and that was on my CV. And the surgeon said, "Are you sure you want to do
Right, right,
surgery? Like, we don't perseverate. We don't, like, theorize. We act."
right.
So again, there's that bit of that tension there. But I couldn't agree with you more that, as a writer, there's so much that you have to draw on, right, from your own experience, and these intense dramas that play out within the four walls of the operating room.
Yeah, 100%. I mean, I think surgeons, that whole thing around, like, yeah, this artistic side, this poetic side, that there's no place for that in the operating room, or in surgery. I don't think that's true. I mean, I think we have this unique opportunity to be with patients, to gain their trust, to enter frontiers that no one gets to go to, body cavities, various things that people don't often get to do. So we have a unique perspective on humanity and the human experience. And I think, at least for me, that's part of the joy of that job. I think surgeons do understand that fundamentally. They do see it. They may dismiss it because it could bring up feelings or emotions or thoughts that make you reflect on bigger issues. And that's the thing too, right? It's hard. It's like you can't go and become best friends with your patient and then operate on them. Why? Because it's just like too hard. Like if you care about people and you have any emotions at all, like that would be an impossible task. If you're a complete sociopath, yeah, you could do it no problem. And there are some sociopaths who can be excellent technical surgeons, right? And do very daring things. But they don't have the balance of the humanity to really offer patients something else beyond technical excellence, which I think patients really want from their surgeons and need. Like the wound heals in different ways, right? Like, yeah, there's the healing, the technical healing part, but the person has to heal from the experience. They have to make some meaning out of that process. And if you help them on their journey through surgery, give them technical excellence, but also make them feel safe and less anxious and supported, um, not only will that bring you more joy in your practice, but I guarantee you those patients will absolutely love you for life and they'll never forget you and they'll think you're the greatest surgeon in the entire world.
That's so amazing. Thank you so much, Paul, for spending all this time with us today. Your insights and your thoughts that you shared with us today, honestly, we'll think about for a long time and hopefully be better off for it. So thank you. One of the last things, or usually the last thing that we ask on this podcast is we ask a guest, if you could go back, and you sort of touched on a lot of these themes, but I'm curious how you would culminate it. If you could go back to being maybe a junior staff person or a senior trainee, what would you do differently? What would you tell yourself
Yeah,
most importantly?
it's such a tough question because like you kind of have to go through the fire to have the perspective to get the other side. So there's this issue around like knowledge and understanding. So I could drop some knowledge on a younger surgeon, but they're not going to understand it. It's the same thing as if you've never practiced surgery. Yeah, you can pick up a textbook of surgery, you can read it, so you have the foundational knowledge, but you still can't do surgery. So it's kind of the same thing. It's like hard to, without having gone through it, I don't know if I could give you specific things or specific advice.
You've been listening to Cold Steel, the official podcast of the Canadian Journal of Surgery. If you have comments or questions, please email us at podcast.cjs@gmail.com. Thanks for listening.